want to wait downstairs for anybody and direct them, or?
I have signs up
All right.
there, so, if you want to.
I'll keep an eye out for
I put up a few more signs as long as I was at it, so hopefully everybody will find their way. So I'll kick us off. I'm Jennifer Cardillo for everybody, and I think almost everybody knows me. Hi. So I'm the head of the Warwick Special Education Advisory Committee, and we have started the speaker series this year. We are going basically once a quarter to have a speaker come in and to educate all of us on various topics. This month's topic is going to on the subject of mental health to align with Mental Health Awareness Month. It's a subject near and dear to a lot of our parents and our educators. I know that maybe a lot of people couldn't be here tonight, but we are recording so that our parents who could not be here and are with their lovely kiddos are going to be able to hear the talk and get some tips and tricks along the way. And all of us who are in the room can help lead that discussion and hopefully enlighten all of us at the same time. So would you like to introduce yourself to everyone?
Sure. I'm Heather Pelletier. I'm a licensed clinical psychologist. My path to where I'm at now has been a little bit of everywhere. But my graduate training was in Ohio at the University of Toledo, and then I did my residency at Children's National in DC, where then I moved on to postdoctoral fellowship at Geisinger in Pennsylvania. So all of my training is really in medical psychiatric complexities. So kids who have anxiety, depression, mental health, but also physical manifestations and experiences that make their daily life difficult. Within that, I more generally treat anxiety also, but that's like a specific niche. So I was at Hasbro Children's Hospital for 8 years or so before taking a directorship position at East Greenwich Pediatrics, where I am building their interdisciplinary integrated team so that all of our patients there have access to psychology and pediatrics. So that's the role I'm in now. I have a special interest in educating schools, parents, everybody who wants to listen at how to use empirically supported, so research supported techniques to help kiddos move out of a place of anxiety into better functioning and quality of life. And so I do different speaking engagements, and recently just did a talk for Warwick's entire social work department on how we can better support kids who are anxious specifically with somatic complaints and school avoidance. So I'm really happy to be here because I think this is a unique opportunity to have, I don't know who's educators and whose parents or
We're going to have
yeah, I think introductions will be nice, but I asked for if the group wanted presentation style or just really casual open discussion with the availability to have pointed questions, because I know sometimes I sit and talks and feel like I leave feeling like, well, that was everything I already know. I really want to get into it a bit more. So there's nothing that you can't throw at me tonight that we can't at least say, I don't know, let me look into that for you, but comfortable to open it up to everybody.
So why don't we do a quick roundtable just so you have an idea of who's around the table. So for me, my daughter is 17 years old, almost 18, will be 18 next month. She is a junior at Tollgate High School. As everybody just heard, she just had a promposal, so she will be going to junior prom on Saturday. And she is just absolutely thriving due to the efforts of the Warwick School District, and a really good match with her educator team, so which has been really, really cool. But that's me, and my daughter's name's Daphne, but I think a lot of you know her. Go ahead, Leah.
I'm Leah Hazel, and I'm on the Warwick School Committee Vice Chair.
I'm Dave Albach. I'm one of the directors of special services. Nice to meet you in person.
I'm Megan McQueen. I'm a special educator at the Pitt School.
And I'm Kristen Murray. I'm the SEL coordinator for the district.
You too.
Caitlin Regan. I am a special educator at Warwick Neck and secretary of the committee.
Would you introduce me? No. I'm Betty Seavey, and I was born and raised in Warwick for many years. I returned when I built a house in '85, and I had two girls who went through the Warwick schools until they got to high school. I have 4 grandchildren. 3 of them are at Immaculate Conception, and 1 is at Wyndham Junior High. So we're having some experiences with the Warwick schools. So it's I'm very interested in what's going on. That's basically why I'm here. I do have a background I have a background in education. I'm also subbing in work, just subbing. And then I have worked in a DCYF program. It's now closed and it went with St. Mary's. St. Mary's bought it out. So I really am familiar with what happens to teenage girls, especially those in custody, because I lived with them for 5 years at Sophia Little. And then I worked at Bayview for an all-girls school, 17 years as director of admissions. And so I really got to know girls there. So I'm here just purely out of interest and concern, because I think what is going on with children today is they are anxious and they have reason to be.
Sure do.
Thank you. Thanks for the context. So when I was asked to speak, it was a little interesting because I was like, wait, is it on behalf of the school district who wants, So I think what I want to make known right from the beginning is I'm on Team Child. And I think it's really important that as grown-ups for our kids at all ages, the educators, the parents, the providers can really all have same message, same follow-through. And I believe in early detection of these issues before they become a bigger problem. And I know that there's agendas and protocols and procedures within school districts that sometimes interfere or conflict with parents' agendas and vice versa. So I think today it would be helpful just to have a rich discussion all the way around and know that all perspectives are welcome as we try to figure out how to help the young kiddos. But what I don't know as a good starting point is how far to get into just some background for anxiety. So I'm going to assume that people don't know anything, even though I know that that's not true. And I'm going to do like an abbreviated kind of discussion around the starting points and where intervention can be helpful. So families know what their part is, schools maybe know where they can intervene, and that it can feel like there's pointed supports in a school system that aren't just getting stuck in this like rote repetition of templated 504s or IEPs or plans that feel like they're not meaningful to anybody. And the best effort of helping, sometimes we get to that space, especially because schools are so under-resourced, right? And we know that to be true. It's definitely not a matter of parents or providers or schools not caring. It's just sometimes hard to maximize resources. So I was going to talk a little bit about the treatment of anxiety. So, because I think you all know, right? Anxiety is just a sympathetic nervous response in the body that actually is meant to keep us all safe. So we don't want that to go away. But everything that I'm saying about children is also true for adults, by the way. So I'm not going to keep going back to that, but for all humans, right? So in essence, something happens to activate our sympathetic nervous. It starts to increase, and then the natural response is to do something to make the anxiety go down, right? Because anxiety doesn't feel good. It's oftentimes a physical manifestation of all kinds of things. In the process, though, of trying to make it go down, a lot of times avoidance is the big way, right, that we learn to do that. So if we take it from obvious things like fear of heights, fear of dogs, things like this, we simply avoid situations where that stimuli might be present. The problem with that is people are not born with those levels of anxiety. They might be born with genetic predispositions to anxiety, but not actually a specific fear of something, right? And it only takes one learning experience. And we've learned in research it can be actually happening to a child or vicarious. So meaning they hear about it, see something happen to somebody else, their parents might tell a story about something that happened to them, and that can be enough to actually encode a specific fear that can start to emerge. And every time the brain or the body sends a signal that they're in danger or something is happening or their belly feels upset or they're having the physical symptoms and they avoid, they are now reinforcing the neural pathways in their brain to become anxious, right? So the more avoidance happens, the more it reinforces an anxiety mechanism in the body. What's challenging about this as adults, especially parents, we're wired to respond to distress, right? So when we see fear, pain, anything that's distressing, we want to jump in to help. Oftentimes, it doesn't matter how well-intended help is, the execution of it can accidentally contribute to neural pathways continuing to be wired anxious. So let's get to some specific examples, right, that have to do with parents and educators. Let's talk about school avoidance, right? That's a big one. And social anxiety. So since pandemic, we've seen, I don't even think we have accurate census of how prevalent anxiety is and social anxiety. Anecdotally, I'll speak from my practice. I would say a massive increase, at least 50% increase. So kids who were well-functioning, pretty well-adjusted, didn't have any school anxiety, come back from pandemic and have 2 years plus of compromised educational experiences, but also problem-solving, peer conflict, resolution, right? Initiating interactions. Then we complicate that with the generation of technology, where it's very much acceptable and